Good morning, guys. Tony Maritato here. So let's talk about an opportunity, and it's just one of 1,000 opportunities, but specifically related to therapists who want to do mobile therapy, whether it's PT or OT, in the home for a specific niche. Now, one of the greatest opportunities, if you guys follow my content, you know that I kind of have niched down over recent years to focusing on total knee replacement. The biggest frustration, when we're talking about marketing, we always want to talk about urgency. We want to talk about the problem we're solving, the customer. The biggest problem that I see for post-surgical total knee replacement referrals is the first 2 weeks after surgery. These are clients that typically have Medicare reimbursement, so we know that we're allowed to deliver services in the home or in an outpatient clinic. The surgeons typically want their patients going to either their in-house therapy or the hospital-owned therapy, or they have a provider with a brick-and-mortar clinic that they've been working with for years and even decades. So it's hard to get into that niche, but if we serve a specific segment of the healthcare delivery system for that niche, I think there's an opportunity. And so those first 2 weeks, the patients aren't able to drive themselves. Quite often, they don't necessarily have a spouse or support system to drive them to outpatient therapy. They're not feeling all that great. And so if you could step into that gap, even if you're not marketing to be the full provider of the entire plan of care, if you're the therapist that will go to the home 1 day post-op, 3 days post-op, if you'll deliver the service for outpatient therapy in the home for the first 2 weeks, and then once that patient is either able to go to an outpatient clinic, or 4 weeks, 6 weeks, they're cleared to drive, and then they can go to an outpatient clinic, you're filling a gap. And so I think that there are a couple ways to approach this. One is, if you're doing mobile therapy and you have a flexible schedule, I would 100% be marketing a service where you will meet the patient upon arrival from the surgical center to the house. So if the patient's getting discharged from the surgical center at 1 p.m., they're expecting to be home at 1:20. You're going to be there at the home ready to greet them so that you can help with the transition from the car to the home. You can complete your initial evaluation. You can help with positioning and bringing peace of mind, answering all of their questions, helping the family. Like, the family is typically so scared because they don't know how to manage this individual who just had the knee replacement. You're the one that's coming in to kind of save the day. Now, I used to say meet them at the surgical center, but most surgical centers won't let you do that. So at least be there ready to meet them when they arrive at the house. You can, I already said, help with the car transfers, help getting them in the home, help answer the questions, complete your initial evaluation. Then obviously you can schedule your follow-ups. You could do the hybrid telehealth and in-person version, which I think is a great option. Or you could just be there, several times until they're ready for outpatient therapy in the clinic. The beauty here is you're not competing with the clinic. If the surgeon wants that patient to go to a specific outpatient clinic, they absolutely can. You're not going to get in the way of that. You can do your evaluation. You could deliver your service. They could get a new evaluation when they initiate care at the outpatient clinic. But you're filling the void that currently exists between they don't want to send that patient on a Part A home health plan of care, but the patient's unable to get to a physical therapy clinic for services. So I think that's a great opportunity. Obviously, the same thing would carry over into post-surgical rotator cuff repair. They're not driving themselves. They're prescribed outpatient therapy services. You could fill the gap, focus your niche on specifically being the expert in your area for post-surgical rotator cuff repair. And then if you're dealing with neurologic conditions, of course, there's that kind of stuff when they're maybe being discharged from a skilled nursing facility back to the home. You could be the therapist that comes and greets them and meets them and helps them get acclimated to returning home. So lots of opportunities there. The idea is, if you're trying to market yourself in a competitive environment, you need to identify the urgency. You need to identify the problem you're actually solving and who the customer actually is. If you're going to be meeting your post-surgical patient at home, the customer is probably the family. The family is probably desperate to have a professional there who's able to help with the transfer from the car to the recliner. So the customer is not always the patient. But anyway, guys, I hope that was helpful. I hope that gave you some kind of food for thought. And let me know if you guys have any other questions about any other topics. I'll catch you guys on the next video.